There's a hidden spot no bigger than a coin that, when gently stimulated for just 60 seconds a day, can help improve pelvic circulation, reduce tension, and in many men, translate into better responsiveness and confidence. I'm Dr. Julia Morgan, a board-certified urologist with more than 15 years in men's pelvic health, and today I'll walk you through exactly where that spot is, why it matters, and how to use a safe 1-minute routine that many of my patients have found helpful. If you want realistic, practical solutions, hit like and tell me in the comments where you're watching from. I read these and they help shape future videos. First, let's clear up a misconception. Age alone is often blamed for declines in sexual function and pelvic comfort, but age is only part of the story. What I see clinically is a mechanical problem that accumulates over time: tension, poor local circulation, and mild nerve compression in the pelvic floor. Imagine a garden hose that's been kinked and left that way. Water can still move, but it's restricted, the pressure is uneven, and the downstream flow suffers. In the pelvis, the same concept applies. Muscles can tighten, small blood vessels can be pinched, and nerves that carry sensation and signals become less responsive. This creates a functional bottleneck far more common than most men realize. Anatomy in plain language. The small area I'll describe sits between the scrotum and the anus. You may hear it referred to in some discussions as the perineum. That term is descriptive from certain conversational transcripts, not a universally standardized medical name. Clinically, we refer to this general region as the perineal area, or perineum. Under the skin here run small arteries and veins, notably branches of the internal pudendal artery, plus sensory and motor nerves such as branches of the pudendal nerve and autonomic fibers that coordinate blood flow. Nearby are pelvic floor muscles, like the levator ani group, that support pelvic organs and influence vascular pathways. When those structures are tense or circulation is sluggish, the downstream effect can be less reliable blood flow and decreased nerve responsiveness. The biology behind why gentle stimulation can help is straightforward but important. When soft tissues are warmed, mobilized, or gently stroked, local blood vessels dilate, and there's an increase in local nitric oxide signaling. Nitric oxide is the molecule your body uses to relax blood vessels and improve flow. Gentle massage and relaxation techniques also reduce tone in tight muscles, decreasing pressure on small vessels and nerves. In short, you're not fixing hormones with a minute of self-care. You're giving the pelvic microenvironment a brief window to relax, flush, and reset. And when done consistently, those brief windows can add up. Now I'm going to give you the exact 60-second routine I recommend. Before we begin, a few safety rules I cannot stress enough. This is an external technique only. Do not insert anything into the body. Do not press so hard that it hurts or causes bleeding. If you have recent pelvic surgery, recent prostate procedures, active infection in the area, are on therapeutic anticoagulants, blood thinners, or have a catheter in place, consult your clinician before trying this. If at any moment you feel pain, lightheadedness, or bleeding, stop and call your provider. This guidance is educational. It's not a substitute for individualized medical care. Positioning. You can do this lying on your back with knees bent and feet flat, seated at the edge of a chair with knees slightly apart, or standing with a slight bend in the hips. Choose whatever feels most comfortable and relaxed for you. Make sure your hands are clean. If you use oil, make sure it's warmed slightly between your palms. Do not use oil that's too hot. Locating the spot. The perineal area is the soft tissue bridge between the scrotum and the anus. Using your index and middle fingers together, gently explore that area to find the most yielding spot, usually a small soft patch of tissue. This is the area we will stimulate externally. If you feel a hard, painful lump or anything that looks like an open sore, don't massage. Call your clinician. Pressure and motion. Imagine pressing the surface of a ripe tomato. You want contact and gentle compression, not squeezing so hard it causes pain. For most men, I recommend one of two comfortable patterns. Method A. circular motion, 30 seconds clockwise, then 30 seconds counterclockwise, or Method B, alternating 5-second gentle press and release, repeated for 60 seconds total. Use a smooth, consistent rhythm. If you choose to use oil for comfort, common options people use are castor oil, coconut oil, or blackseed oil. These are traditional, over-the-counter choices used for lubrication and comfort, not medical cures, and should be used in small amounts and warmed slightly between your hands before contact. Avoid anything scented or medicated unless cleared by your clinician. Hygiene. Wash your hands before and after, and make sure the skin in the area is intact. If you notice soreness, cuts, or bleeding, stop and consult your provider. If you're on blood thinners or have clotting disorders, check with your clinician first because the skin may bruise more easily. I'll guide you through a live 60-second demonstration now. Speak this aloud to the viewer and follow the timing. If you're filming, an on-screen timer is useful. If not, you can count softly. Again, gentle pressure, no pain, external only. Take a comfortable position. Breathe slowly and let your belly expand as you inhale. Place your index and middle fingers together. Find the soft area between scrotum and anus. Apply the pressure you would use on a ripe tomato. Comfortable, not painful. Begin circular motion now. Slow clockwise circles. I'll count quietly with you. 10, 20, 30. Now switch direction to counterclockwise. 10, 20, 30. Or if you prefer the press-release pattern, press gently for 5 seconds, release. Press 5 seconds, release, and repeat 6 times. Finish with a long exhale and rest for a moment. That's 60 seconds. After the massage, drink a glass of water within the next 20 minutes and take a short 5 to 15-minute walk if you can. The combination of local stimulation, hydration, and gentle movement helps distribute the blood flow and maximizes the brief window of improved circulation. Now let's broaden the strategy because the 1-minute routine works best when paired with simple daily habits. First, movement. Short walks matter. Aim for 2 or 3 10-20-minute walks a day, ideally including one after a meal. Walking increases overall circulation, improves endothelial function, the health of blood vessel linings, and helps shift pelvic blood flow dynamically so tissues don't stay chronically congested. Second, breathing. Diaphragmatic breathing, deep, controlled breaths that expand the belly, can reduce overall sympathetic arousal, stress response, and lower pelvic muscle tone. A practical breathing pattern is 4-2-6. Inhale for 4 seconds, hold gently for 2 seconds, exhale for 6 seconds. Do 5 slow cycles in the morning and 5 before bed, or do them right before your 60-second massage to relax the pelvic floor first. Let me put this into a simple daily routine you can follow. Wake up, do 5 diaphragmatic breaths, 4-6, do the 60-second perineal routine, then take a 10-minute walk after breakfast. Repeat a short walk mid-afternoon and practice another 5 deep breaths before bed. Commit to this routine for 3 weeks and track small changes: sleep quality, nocturia, nighttime bathroom trips, perceived pelvic comfort, and confidence. Those are realistic, measurable outcomes to watch for. Clinical realities and why pills are sometimes only a mask. Medications prescribed for erectile dysfunction primarily work by amplifying blood flow pathways, often by enhancing nitric oxide signaling. That can be very effective, but it treats the symptom, insufficient blood flow at a moment of arousal, rather than the mechanical tension or chronic circulation deficit that underlies some men's problems. If pelvic muscles are chronically tight or small vessels are compressed, medications may help but won't retrain the tissues. That's why integrating short daily mechanical reset habits and movement can be a complementary approach. Important note: do not stop or change prescribed medications without discussing it with your prescribing clinician. I want to share 3 brief anonymized patient examples to illustrate what this can look like in real life. These are composite summaries to protect privacy, but they capture common patterns I see. Robert, 64, came in complaining of weaker morning erections and waking twice nightly to urinate. He had no major cardiac disease, but had a physically demanding job and reported chronic low back stiffness. We started a conservative plan, the 60-second perineal routine, daily walks, and breathing work. Within 5 days, he reported feeling less pressure in his pelvic area and a small return of morning rigidity. By 3 weeks, his nocturia decreased by 1 trip per night and his confidence improved. Robert was thrilled, but understood this was not a guaranteed cure. He continued follow-up with us and maintained the daily habit. James, 70, had tried pills with limited effect and felt discouraged. He had pelvic floor tightness on exam and mentioned routine sitting for long hours. After we introduced the 1-minute routine plus short standing breaks and pelvic relaxation techniques, he reported decreased pelvic ache within 2 weeks and better response when using medication. For James, the combination approach made medication more effective because local mechanics improved. Daniel, 65, presented with more complex issues, long-standing diabetes, and vascular risk factors. He tried the technique but saw only marginal change after 3 weeks. Because of his risk profile, we escalated to further evaluation, vascular studies, and referral to pelvic physical therapy. Some men with significant systemic disease will need multidisciplinary care. The 1-minute routine can be part of that plan, but it may not be sufficient on its own. Those stories show a range. Some men notice changes within days, many see gradual improvement over a few weeks, and some require more formal medical evaluation. That's why I emphasize consistent tracking and when to seek help. Let's address common questions you may have. Question: will this technique cause harm or infection? Answer: when done gently and externally with clean hands, this is low risk. Avoid massaging over open wounds, sores, or varicose patches. If you notice any skin breakdown, bleeding, increasing pain, fever, or drainage, stop immediately and call your provider. Question: I'm on blood thinners. Can I do this? Answer: if you take anticoagulant medication, e.g. warfarin, apixaban, rivaroxaban, check with your prescriber before starting. The perineal skin can bruise more easily on these meds, and your clinician can advise safety or alternative approaches. Question: can men with catheters or recent prostate procedures perform this? Answer: no, do not perform this if you have a urinary catheter or if you've had prostate surgery or an invasive pelvic procedure within the last several weeks without clearance from your surgeon urologist. External pressure could interfere with healing or introduce risk. Question: what if I have hemorrhoids or anal fissures? Answer: if you have active anal rectal conditions, ask your clinician first. Gentle perineal stimulation may still be possible, but if it aggravates hemorrhoids, stop and seek guidance. Question: is this a substitute for pelvic floor exercises like Kegels? Answer: no. Kegels are contractions intended to strengthen pelvic floor muscles. The 60-second perineal routine is intended to relax and mobilize local tissues and circulation. For many men, the right program includes both relaxation and strengthening work tailored by a pelvic floor physical therapist. In fact, men with overly tight pelvic floors may be harmed by aggressive Kegels without prior relaxation training. Question: how long before I should see a urologist if there's no improvement? If you followed the routine consistently for 3 weeks with no perceived improvement, or if symptoms worsen or you have sudden changes, sudden worsening erectile dysfunction, severe pain, new lumps, bleeding, schedule an evaluation. Your clinician may recommend pelvic floor therapy, vascular testing, hormone evaluation, or other interventions. Question: are there clinical trials proving this works? The physiologic rationale is sound. Local stimulation can increase blood flow and reduce muscle tone, and we have solid mechanistic understanding of nitric oxide, blood vessel response, and muscle physiology. However, large randomized controlled trials specifically testing this brief perineal routine are limited. Many of the outcomes we discuss are mechanistically plausible and supported by clinical experience and smaller studies. Labeling the approach as helpful should be read in that context, not as definitive universal proof. Troubleshooting tips if you experience problems. If the technique causes stinging or sharp pain, stop immediately. Try the following: reduced pressure, increase lubrication, move to a more relaxed position, and focus on slower breathing. If you see bruising, stop and consult your provider. If you notice skin irritation from an oil, discontinue that oil. If improvements plateau after 1 to 2 weeks, add the movement and breathing practices consistently and consider a referral for pelvic floor physical therapy. Therapists trained in men's pelvic health can assess whether your pelvic floor is overactive, underactive, or out of balance and build a tailored plan. Lifestyle modules that reinforce gains. Sleep and hydration are crucial for vascular health. Aim for consistent sleep timing and avoid excessive alcohol, which can both impair erections and fragment sleep. Hydrate sufficiently. Moderate daily water intake supports blood volume and circulation. Extreme dehydration can reduce effective blood flow. Strength training twice weekly supports overall vascular function and testosterone balance, but avoid chronic heavy straining in the pelvis without proper technique. Sitting for prolonged periods compresses the perineal tissues. Use standing breaks every 30 to 60 minutes if your routine requires sitting. A short pelvic movement routine to do daily. Stand with feet hip-width apart. Tilt the pelvis forward and back slowly 5 times. Then, inhale and allow the belly to expand while relaxing pelvic muscles. Exhale and gently draw the pelvic floor up like a slow lift. Hold 1 second and release. Repeat 5 times as a relaxation cue, not a forceful contraction. These movements increase awareness and reduce chronic bracing. Let me outline a simple, trackable 3-week challenge so you can test this for yourself in a structured way. Week 1, commit to the 60-second perineal massage once daily, 5 diaphragmatic breaths in the morning, and 1 10-minute walk after lunch. Keep a simple diary. Note sleep quality, nighttime bathroom trips, and perceived pelvic comfort each day. Week 2, increase to 2 10-minute walks and add a short movement break mid-morning. Continue the massage and breathing. Week 3, maintain the routine and reassess. Are you seeing fewer nocturnal trips, less pelvic pressure, greater morning firmness, or improved response when you're intimate? If yes, continue. If not, or if you have concerns, schedule an appointment to explore further testing and referrals. A few final practical tips. Keep the massage short and non-compulsive. This is a 60-second reset, not a lengthy ritual. Use a gentle, neutral oil. If you choose to use one, warm it between your palms. Avoid scented or commercial topical analgesics that you haven't discussed with a clinician. Keep your expectations realistic. Some men notice early improvements. Many see gradual change, and some need additional medical care. The goal is restoration of function through consistent, low-risk self-care combined with sensible lifestyle habits. Before we close, I want to repeat important safety notes. This technique is external only. Stop immediately if you experience pain, bleeding, or sudden worsening of symptoms. If you have recent pelvic surgery, a catheter, active infection, significant cardiovascular disease, diabetes with neuropathy, or you are on anticoagulants, consult your healthcare provider before starting. This video is for education and does not replace a one-on-one medical evaluation. If you have significant erectile dysfunction, recurrent urinary issues, or sudden symptom changes, seek a formal clinical assessment. Some conditions require medical or interventional therapies beyond self-care. If you're willing to try the 3-week, 60 seconds a day approach, start tonight. Take 5 diaphragmatic breaths, perform the gentle perineal routine for 1 minute, hydrate, and take a short walk. Track what changes. Small wins matter. 1 fewer nighttime trip, less pelvic tension, or a boost in confidence are all meaningful. Thank you for trusting me to walk you through this. If this information spoke to you and you want more evidence-based, practical men's health guidance, subscribe to the channel for weekly updates. Share this video with a man who might appreciate a simple, low-risk option to try, and tell me in the comments the one change you'll start tonight. Remember, Individual responses vary, and professional evaluation is recommended for pain, bleeding, on blood thinners, after recent surgery, or when symptoms are significant. This guidance is educational and should be used alongside advice from your healthcare provider. I'm Dr. Julia Morgan. Be safe, be consistent, and take care of yourself.